Hello there. Welcome in. I'm assuming you're here for the cranial nerve exam. Great. Well, I'm Dr. Nirvana, and I'll be checking you out today. But first, I'd like to get to know you a little better. Okay, and so is it alright if I ask you a few questions? Okay, good. So, what is your first and last name? It's very nice to meet you. And your date of birth? Okay. And how are you feeling today? Has it been a busy day, stressful, anything like that? Okay. I feel you. Definitely the busy season. And are you comfortable at the moment? Everything is feeling okay physically? Okay. Good to know. And any allergies that we should be aware of? Okay, nope. Now, what brings you in for the cranial nerve exam today? Alright, so some headaches, dizziness, migraines, okay. Oh, hate migraines. And have you ever had a cranial nerve exam before? No? First time for everything, right? Okay. And any numbness or tingling, any pain physically on your body? Okay, and any change in smell or taste? Okay. And how about any recent injuries? Oh, sorry to hear that. That's why you always gotta wear a helmet. That is for sure. Always got to wear a helmet. Okay. So I think that about covers the questions that we need to go over before the exam, but is there anything else that I should know that you'd like to tell me? Okay, so I think we can get started. So just make yourself comfortable. I'll try not to take too much of your time today, but we're going to have to go through each cranial nerve thoroughly, so I hope that's alright. Okay, so before we get into the actual exam, it's important that we take your vitals, just like the start of any other medical exam that you've had in the past. So if you would please just give me your index finger, I'm just going to clip this on there. Alright, now just leave that on there, let that rest. We'll get to your pulse here soon. And if you just raise your arm for me, and you wrap this right around there, and take your blood pressure. So just tell me if this gets a little too tight, okay? Okay, let's read that. Alright, 126/75. That seems to be a little elevated. Have you been particularly stressed or anxious, overwhelmed recently? Okay. Yeah, it's normal to have fluctuating blood pressure levels, but just want to make sure that you're keeping tabs on your health and prioritizing sleep, nutrition, exercise, all of that. But generally, it's okay for it to fluctuate time to time. Okay. So let's see that pulse. Okay, looks good. Just write that down. Alright, and lastly, I'm just going to check your heart rate and your breathing. So I'm just going to put this up here. Alright, listen to your heartbeat. Sounds good. Now good, and on my count, can you just take a deep breath in and out? Alright? Deep breath in and out. Alright, good. Now wheezing. Gonna wrap around you quick. In and out. Alright. On this side. In and out. Okay. Well, that all sounds good. Healthy lungs, which is, we love to see it. So, now we can get into the exam. And before I start, to be sterile, of course, I have to wear gloves. And since you said that your troubles were mainly focused in the head, dizziness, migraines, headaches, we're going to start with some areas that are not typically affected or cause those effects, just to get them out of the way, make sure everything's going smoothly there so that we can focus on those areas that have been causing you trouble, okay? Okay. So, we're going to start off with cranial nerve 1, which is your olfactory, okay? And can you tell me what that is? Yes, indeed, it is smell. And so, I'm just going to have you smell some essential oils that we have here in the office. And if you would just tell me what you think that they smell like, okay? Okay, now just take a nice little whiff of this in through your nose. And what does that smell? Yes, lavender. Alright. And this smell, what would you say this smells like? Peppermint. Yes, just like Christmas. Okay, and then that looks good, but just to see how good your nose really is, I do this to all of my patients, see if they can guess it, but it is my favorite candle in the office, and it's particularly specific, but let's see, take a whiff. Autumn, that's very close. It's a pumpkin pecan waffle, which is my favorite scent. Autumn's a pretty good guess as well. Pretty close to the actual thing. But anyways, your olfactory nerve looks good. You can smell. Looks good there. So let's move on to your optic nerve, your cranial nerves 2, 3, 4, and 6, which are your optic, oculomotor, trochlear, and accumbens. Okay? So we're going to test your vision and your eye movement. Okay, but before we get into the light, actually, I noticed something up with your eyes. If you could just open them for me. I'm just going to check around them. Make sure they're fine. Now I noticed some swelling around your eyelids. Have you by chance cried anytime recently? Okay. No, that's totally okay. Everyone cries, it's normal. I just wanted to make sure it wasn't any medical reason, of course, but yes, just look around a bit. Look around. Yeah, okay, everything looks good. Everything looks good there, but let's see your pupil dilation, okay? So now I'd like you to just look at the tip of this pencil, not at the light. Just stare right at this tip of this pencil with both your eyes. Stare straight ahead, right at this. I'm just going to look in your eyes, see the pupil dilation when I pass the light by. Okay. Yeah. Alright. Well, dilation looks good. Now let's go over here. Okay. Alright, now again, focus right here. I'm going to pass the light behind it. Okay. Alright. Well, that looks good. Now just to cover this eye, I'm going to come in here and really inspect. Okay. Look right at the light now. Right at the light. And look around, don't move your head, just look around a bit. Alright. Yeah, that looks fine. Okay, yeah. There seems to be something going on here, I'd say. Nothing too out of the ordinary, but I have seen it with a lot of people who are suffering headaches and migraines that it It stems a lot from eye problems, vision problems. You know, I wear contacts, so if I wear contacts too long, I start getting a headache by the end of the day. So it could be something along the lines of that, but we're gonna focus on the optic nerves for a little longer than the other ones, as I suspect that to be the main issue here. Okay, so now just follow the light for me across your vision. Follow the light. All right. Well, eye movement looks okay. Eye movement looks okay there. Yeah. Okay. And just count how many fingers I'm holding up. Okay. How many fingers? Okay. Yeah. That looks good. Now, I want you to tell me as I bring the card further away when it starts to get a little blurry, okay? So, just read the letter or the number on the card. Tell me when it starts to get a little blurry, okay? Okay, here, it's pretty clear. Pretty clear. A little worse. A little more blurry. Okay, a little more blurry. Okay. Just let me know when it's too blurry. Okay, too blurry. That was about René. Now this side, let's see. Same thing, just tell me when it starts to get blurry. Okay, looks good. Looks good. Looks good. And a little more blurry, a little blurry. Okay, so about the same distance. About the same distance for each eye. But, I'm gonna test the peripheral vision now, so just tell me when my fingers leave your sight, okay? Okay, good. 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 Okay. Yeah. Alright. Well, all of those seem fine, I would say. I think it's really the dilation that we have. Let me look in your file to see if you had any issues with that before you could remember. Have you had issues with your eyes in time recently? I know you said not in the near past, but before that, maybe? Anything in childhood? Okay. So, I think what I'll do for now, before we go to the other thing, just for now, for a temporary fix, I'll give you some eye drops, see if that helps out. There seems to be a little bit of redness in your the veins of your eye too, so I'm thinking there might be like a corneal abrasion or something, because I mean, I've had that and it really is, it's painful and it's a cause of a lot of problems. So I'm just gonna give you some eye drops quick. So just open your eyes nice and wide for me. Okay. Okay, now other eye. Be still. Okay. Okay. There you go. So, like I said, temporary fix. We'll see what happens, and if that seems to help by the end of the exam. Okay. So now we're going to move on to cranial nerve 5, which, don't ask me why 2, 3, 4, and 6 skips 5. I'm not entirely sure, but nonetheless, cranial nerve 5 is the trigeminal nerve, and that will cover your facial sensation and jaw movement. Odd combo, but I know. But I want you to close your eyes. Just close them for this. I'm going to tap a spot on your face and just like you to tell me where I tap, okay? Okay. I'll just keep them closed. Okay, where was that? Forehead, yep. And closed. And that. Cheek. And now, yes, your chin. And then right, lastly. No, it's very good, very good. So it looks like you can feel properly, which is always good. All right. So jaw movement. Could you just show me what you can do? See if you can do like all that stuff. All right, and just maybe pretend like you're chewing something really squishy and chewy, like a nice marshmallow. Okay. Very good, very good. Looks good to me. And then lastly, clench your jaw. Okay, Mog. I see you. I'm just kidding, but looks good in that department. Moving on to the 7th cranial nerve, your facial nerve, which includes facial expressions and your taste. For this, it's gonna be a little fun exercise that we do. So, if you could just make the face, the reaction that you would have to my sentence, my proposed scenario, okay? Okay, so you just won the lottery. Yes, there you go. And now your best friend is moving away. Brownie face, yep, there you go. Let's see. Someone just ate the last bite of your dessert. There you go. Let's see. Oh, someone just sneezed on you. Yeah, there you go. And lastly, you are a pufferfish. Yes, there you go. And everything looks good there. So let's see your taste. And I just have a gummy here. Love gummies, hopefully. Is gelatin fine for you? Okay. Well, here's this gummy. Just go ahead, plop that in. And could you tell me what that tastes like? Blueberry, there you go. Okay, so CN7 looks good to me. Can check that off. So what are we at now? We are at the vestibulocochlear, which is your 8th cranial nerve, and that is accounting your hearing. And so I have 2 exercises for this. And for the first, I'd like you to close your eyes and tell me what side or to point to where you hear the sound coming from. Okay? So I have some objects here. It's going to be object and sound identification, the left or right side, and also counting how many times you hear said sound, okay? Okay. You got all that? Okay, good. So ready? Okay. There you go. And how many times? 5. And do you know what object? Okay. Scissors, good. So just one more time. 3 times. There you go. Okay, now same thing, keeping your eyes closed. How many times and what object and where is it coming from? There you go, and now again. Good. If that object was a little harder, it's because I meant it to be. It's AirPods. If you got that, then very good work. Now let's see. I want you to keep your eyes closed now for this next exercise, and I'm going to say a sentence or a phrase, and it's going to increase in volume as I say it for longer. And I just want to tell you, or I just want you to tell me when you can begin, when you start hearing it. Okay, it's gonna gonna start off really, really quiet and get gradually louder, okay? Okay. But don't read my lips, that's why the eyes are closed, okay? So. There you go. There you go. The cow jumped over the moon. And let's go again. This time, for sure, I'm going to cover my mouth in case you're peeking. Good. The cat's in the cradle and the silver spoon. Okay, so hearing sounds good to me. And now let's move on to cranial nerve 9 and 10, your glossopharyngeal and your vagus nerve, which is going to account for swallowing and vocal inflections and sounds. And so for the vocal, I thought if you could just match the pitch the hum that I'm making, and just quick, I know you've been talking to me this whole time, but I just want to make sure that the vocal cords are sounding properly, no mufflingness or anything like that, okay? Ready? Good. And good. And okay, there you go, sounds good. And if you would just give it a little swallow for me. Okay, looks good there. Moving on to our last two nerves here is your 11th, your accessory nerve, which controls your shoulder and neck movement. And let me just feel everything. You said there was no pain in these areas for you, right? Okay, good. Yeah, it feels okay. Could you just shrug your shoulders a bit for me, just like this? Okay, and then the other way. Okay, I'm just gonna put my hand on your face like this. I just would like you to push against it, okay? Alright, now push. Okay, now push. Okay, looks good. So everything looks good there. Now cranial nerve 12, your hypoglossal nerve, and this will account for your tongue movement and also goes with vocal pronunciation. So just move your tongue out around a little bit. It's like, ah, there you go. And just to pronounce a few words, could you just repeat after me? Okay. Light. Okay, good. Bumblebee. Good. And peppermint. Yes. And fun one, Coca-Cola. Okay. There you go. Well, those look great. Overall, everything looks good except for your optic nerve at the moment. I think there might be something going on with the eye itself, but your nerve, I think for now it's okay, but we're gonna give you an antibiotic, and definitely no putting anything into your eyes for the foreseeable future. Be careful if you get anything in them, make sure to wash it out, but be sure not to rub them or touch them or anything like that, because suspected that there you have some type of abrasion or cut along your pupil that's contributing to these headaches and dizziness and migraines. So yeah, we'll get you scheduled for that. But for now, is there anything else you'd like me to check out for you while I'm here? Okay. Well, have a good rest of your day, and I hope that you start feeling better. And, yeah, have a nice night. Well, that was just a little cranial nerve exam roleplay. I know you guys enjoyed the last one that I did of these, and I really just wanted to try it again. So I hope you enjoyed it, and I hope you enjoyed the soft-spoken style of the video. I can't talk. But, yeah, as always, I hope each and every single one of you has a very